Hi, today we are talking about drain care. A drain is placed during breast surgery to allow body fluid to be removed from the surgical cavity effectively. It can be removed once the drainage amount is minimal. Let's learn how to care for your drain at home right now.
Before we begin, please prepare 2 pieces of alcohol swabs, a new bottle, and a pen with your post-breast surgery drainage record. Let's learn how to care for your drain at home right now. Step 1. Place your Prevac bottle on a flat surface area. Step 2. Check the Prevac bottle vacuum indicator. Vacuum indicator should remain compressed if the vacuum is intact. The vacuum indicator will be expanded if the vacuum is lost. Step 3. Read the level of fluid in the bottle. Step 4. Record the current level of fluid on your post-breast surgery drainage record. If you notice that the vacuum is lost or the bottle is 3/4 full, it is time to change the bottle to a new one. Step 1. Wash your hands with soap and water. Take out the new bottle from the packaging. Step 2. Close the clamps on both the tubing and bottle. Clean the connection point between the tubing and the bottle with an alcohol swab. Step 3. Unscrew and disconnect the tubing from the bottle. Step 4. Clean the open end of the tubing with an alcohol swab before connecting to the new bottle. Step 5. Release the clamps on both the tubing and new bottle. Make sure there is flow of fluid from the tubing to the new bottle. Call your breast scanners and seek medical consultation if any one of the following conditions occur: fever of 38 degrees and above, increased redness, swelling or bruising at the wound site, excessive discharge or bleeding from the wound or drain site, severe pain at the wound site not relieved by analgesia, fluid in the drain is bright red, cloudy, yellow or foul smelling, wound gapes open.
If the tubing slips out from the chest or under axilla, place a clean gauze over the drain site and secure it with a plaster. There is no need to go to the hospital. Contact your breast scanners for advice. If you need to clarify on any of the above conditions, you may contact your breast scanners during office hours.